Have you seen someone and you have seen their tongue, or your child or anyone you know has this whitish coating on the tongue when they talk or when they open their mouth? This is a sign of something and is not a good sign for someone that has been practicing proper hygiene and still you have this whitish coating on your tongue. Then this video is for you. Join me from the beginning to the end of this video to know everything you should know about this whitish coating on the tongue. Oral thrush, also known as oral candidiasis, is a fungal infection of the mouth caused by an overgrowth of Candida albicans, a type of yeast that normally present in small quantity in the mouth and in the gastrointestinal tract. However, when the balance of this bacteria or yeast is disrupted, candida can multiply, leading to an infection. So when this candida overgrows, it shows that whitish coating on the tongue that you see, just like this. Then what are the causes of oral thrush? The first one is an weakened immune system. If you have conditions such as HIV, you have diabetes, you have autoimmune disorders that can weaken your immune system, making this individual more susceptible to oral thrush. So these are the conditions that predispose you to having this condition. The next one, antibiotics use. Antibiotics can disrupt the balance of bacteria and yeast in the mouth, leading to this condition. That's why you just don't need to take antibiotics without proper laboratory investigation and culture, and your doctor helps you to determine the best antibiotics for you. Don't just take them. The next one is poor oral hygiene. Inadequate brushing or flossing or rinsing of the mouth can create an environment conducive for this fungi growth. So when you are not taking proper care of yourself, this can result to oral candidiasis. Then when you have dry mouth, conditions that causes dry mouth, such as certain medication, there are certain medication that you can take, it draws out water from the body that and cause dehydration. Any condition that causes dehydration, or you have been breathing with your mouth for a while, it can increase your risk of having an oral thrush. The next one is smoking. You use tobacco, and this can irritate the mouth and weaken your immune system, making it easier for candida to grow. Then the next one is dentures. You have been using those fixtures that are used by the dentist to improve appearance of an individual. Maybe the teeth fell down, or you want to use it to improve your appearance. All those things can create a room for candida to grow and accumulate in your body. So what are the symptoms of oral thrush? What will you see? You will know that you really have an oral thrush. The first one is white lesions. You have something creamy like this, slightly raised lesion on the mouth, as if the mouth breaks. Then there is an inner cheek or on the roof of the mouth, or in the gum or in the tonsils. This is a sign that you have this oral candidiasis. The next one is redness and soreness is the next one. So the affected area may appear red and inflamed, and sometimes painful, making you uncomfortable. So especially while you are eating or drinking, due to that crack, it's usually painful. Then the next one is loss of taste. Some individual may experience loss of taste or altered taste sensation. This can make you to not to have the taste of food or anything entering your mouth, is definitely a sign. So the next one is difficulty swallowing. In severe cases, this oral thrush, due to this white coating, go to the extent of blocking the esophagus. So this at some extent, it can cause difficulty in swallowing or feeling that something is stuck in your throat. This is a sign. Then another thing is when there is cracking in the corner of your tongue. there is cracking in the corner of your tongue, this can be a sign. Then oral thrush may extend to the corners of the mouth, causing your crack and redness. Then the next thing I would discuss is the treatment. Some people ask, what is the treatment of this condition? The first treatment is antifungal medications. You have to take antifungal medications such as cotrimazole, nystatin, that's the drugs, fluconazole, are the commonly used medications to treat this oral thrush. So these medications are usually applied directly to the mouth or the affected area. Then the next one is practice good oral hygiene. Then habits including brushing of your teeth and tongue twice a day. Always brush twice a day. Then flushing the mouth when you eat some certain things. This can help you not to come down with this condition, using of antiseptic mouthwash and the rest of them. Then the next thing is addressing any underlying issue. If you have anything, any underlying causes that might be causing your symptoms, maybe HIV, when some people are placed on their drugs, they find out when their immune system comes up, all these things will disappear. And address the issue of diabetes. If you have diabetes, always take your drugs so that your sugar level will be kept at minimum. All these symptoms will disappear. And also, this can help you and prevent the reoccurring of this infection. The next one is denture care. Proper cleaning and maintenance of these dentures, all these materials you people put in the teeth and the mouth for beauty, including regular removal and cleaning of them, and also disinfecting them, can help you not to come down with this oral thrush. So if you have watched this video to this extent, give this channel a thumbs up, like this video, follow for more health tips. Thank you.